So welcome to this TransplantChild webinar. My name is Ana Teixeira. As I was telling, I am a pediatric nephrologist at Centro Materno-Infantil do Norte, Unidade Local de Saúde Santo António, here in Porto and Portugal. And I will be sharing this webinar and presentation together with Federica Lotta. Federica, she is the manager of ERN TransplantChild Operational Area for and working at Azienda Ospedale-Università Padova. We titled this webinar as Information That Inspires, exploring TransplantChild's current resources for people living with a transplant and how to contribute to the future ones. So we were going to briefly tell you most important contents and materials that we have already prepared to our patients and families regarding their transplant and how to live with a transplant, and also to have some information from you and from patients and families on how we should prepare new materials, new contents. That's the main purpose of our webinar. I'm sorry, I forgot to tell you that this webinar is being recorded, so it can be futurely shared in our website as usual, as all others webinars that have been presented during this ERN. Can you move forward now? So this is me, this is Federica. I think you already know both of us. And we prepared this webinar on behalf of all our group, the Dissemination Working Group. So it is to say Professor Giorgio Perilongo, he is the TransplantChild representative from the same hospital where Federica works, Azienda Ospedale-Università Padova in Italy. Also my co-workers, Dr. Sara Mosca and Dr. Conceição Mota. Dr. Conceição is also our HCP representative, and our team from Hospital Universitário de La Paz, Maria Jesus Pascal, George, and Marta Casales. So thank you everyone for your collaboration and to help us to prepare and to improve the contents of this presentation and this webinar.
So very briefly, I want to really very briefly to introduce the European reference networks and to present TransplantChild. So the ERNs were created by the European Commission in 2017. They are virtual networks connecting healthcare providers across Europe. I like it to say in very simple words that by then, in 2017, the European Union was already a reality, was in existence from the politics point of view, from the economics and from the culture. And it was time then, it was recognized to be the time to build the European Commission of Health. So where to start from? It was obvious, it was it made sense to start from the rare or complex diseases. Why? Because no country alone, no country in itself has the knowledge and the resources to address diseases such rare or complex that require highly specialized treatment. So only putting together knowledge and resources and people on an upper level, that is to say, a European level, we would be able to make steps ahead and to make improvements in the field of rare or complex diseases. TransplantChild is one of the 24 European reference networks. It connects 40 different hospitals across 21 countries, as you can see in the map. And TransplantChild is the only network which doesn't focus on a particular group of diseases, of rare or complex diseases, but on a rare and complex procedure, such as the pediatric transplantation, which in most cases is the ultimate cure for a rare or complex disease. So if TransplantChild focuses on all types of transplant programs, from pediatric hematopoietic stem cell transplant to all the solid organ transplant programs, that is to say heart, intestinal, multivisceral, kidney, liver, and lung. As you can imagine, a lung transplant is completely different from a bone marrow transplant. So it is sometimes difficult to find common grounds, but the network itself was built with a different mindset, with a different approach, the opposite one, that we have to look for common areas because there are common areas as immunosuppression, rejection, tolerance, infection, and the psychological well-being, not only of the patient, but also of the family. So what is TransplantChild's main aim? Is to connect people, all kinds of people related to pediatric transplantation. That is to say, patients and their families, the patients' associations, the healthcare providers, and all type of professionals across Europe. What is our goal? Is to have a significant impact on the quality of life of transplanted children and their families in the long run. This is a TransplantChild website, and it's our main source of information and dissemination. So I reported here the homepage. You can see that there are two separate sections, the one for patients and families, and all the resources we will be talking about in this webinar are there. You can find them there. And then there is the section for professionals. Very briefly, I want to say that we are in the second phase of the project, which will run until the 30th of September 27. So the first phase, the first area of TransplantChild has come to an end, and now it's time to start working for the future. The project is divided into 10 work packages. You can see them listed here. And Anna, myself, and all the other people mentioned before are committed to the work package, to the dissemination. What is this work package about? Is basically, we can say it's the microphone of all the other work packages, because we want to give voice to all the activities, the initiatives, the research that are developed by the other work packages. We want them to advertise them, to share what it is done on the network level to all the relevant stakeholders, using all the different channels we have and targeting them. We are well aware in our work package that the language is a barrier, and it can be challenging because, of course, we work in English. The materials we produce are in English, even this webinar. And we know that it is a barrier, especially when it comes to reach patients, who are kids ultimately, and their families. So we know how needed, and I could even say compulsory, is to provide a translation into the national native languages of the network. And also that sometimes activities which are taught and developed at the network level need then to be adjusted and adapted at the local level, local or national. And I think we believe that in doing this, we really need to work together with patients, families, and patients' associations. Now, I will briefly present the 6, let's say, resources we have already developed. And then Anna, I will leave the floor to Anna. She will introduce the new resource we have been working on, which is the survey for patients and families. So, as I said, you will see the link here of all the those resources I will be speaking about, and the link is the one of the on the website on the patients and families section. So we are very proud of our testimonies ebook. Why ebook? Simply because it's not printed, it's online. The title is A Brighter Future. You can download it. And it is a collection of testimonies or stories of kids or parents speaking on behalf of their kids, telling about their story with the transplantation they have underwent. They share their story, their fears, their doubts, their certainties, but also their hope and their happiness in order to to let other people out there who have experienced the same situation, who are about to feel you, to make them feel you are not alone. I've gone through the same situation. I can understand you. You are not hopeless. And as I wrote here, we believe that sharing stories, regardless the country, the specialist, or the hospital, is part of the cure itself. The ebook is 181 pages long. It contains 29 stories from 7 different countries: France, Germany, Ireland, Italy, Lithuania, Portugal, and Spain. And we are very happy because we could have a testimony representative for each transplant program. Here, I just want to show you 2 examples. This is from a story by Anna, an Italian patient. So on the left, the book is organized in such a way that on the left, you have the national language, so the story written by the patient or by the family, and then you have the English translation on the right. You can see this is a story of kidney transplant from the sentence below, but also from the drawing, from the picture, which makes it immediately recognizable. Anna structured her testimony, you see, in little paragraphs. We suggested some topics to talk about. So the age of transplant, the main concern, the outcome, the message for the ones waiting for a transplant, and so forth. But then here you can see another example. That's from a patient, Elena, from Spain, with a multivisceral transplant. She actually wrote freely as she wanted. And that's because we really wanted this book to be at the service of the patient talking about himself or herself, and the patient's reading. So we didn't want to impose anything structured. We respected even what they didn't want to share. And then the second material I want to introduce are our tips, which stand for Transplant Child Informative Pills. They are 11 short animated videos, so they are kind of comics, short, 1-2 minutes long, and they are all on YouTube. Those videos answer the question, the general question: how will my life be after transplantation? When it comes to school, when it comes to solar radiation and protection, when it comes to sports and active life, how will be my life after transplantation as regards pets and animals, friends, making a tattoo or a piercing, taking alcohol or drugs, having a love life and sexual relationships, and again, how will be my life after transplantation when it comes to vaccines or food safety or immunosuppressants. As I said, you can find them on YouTube. When you watch a video on the right, you can see all the other videos uploaded. And to go back to what I was saying at the beginning, so the importance of the translation into the national languages, you can see the videos with the subtitles in some languages. Here you see you have to click on the little wheel settings, and here are the languages with the subtitles provided. Of course, we would like to have all the transplant child languages available with the subtitles. So we really ask for your help in the translations of those tips, but also with every type of material. And we want to reassure you, we are not asking you to translate from English from scratch, because it will be very difficult and time-consuming. We will provide you with an already made translation into your language, made by an EU tool, like a sort of Google Translator. So the translations are pretty much accurate. You just need to check that there are no mistakes in typing or that all the sentences make sense. But I mean, in the case, for instance, of the videos, every video, the translation for the subtitles won't take more than 5 minutes. Then we have the infographic on pets. Again, here you can see the languages in which this flyer has been translated into. It's very catchy, very simple in reading, and it touches lots of different aspects on having a pet when in the family there is a transplanted kid. Another resource we really believe in is what we call the Guide for Transplanted Children. Well, it's not a guide, it's a booklet which contains a lot of recommendations for children once transplanted. Again, here are the languages with the translation already provided, but we would like to have all, as I said, all the other translations. The booklet is 18 pages long, and as you can see here from the index, it covers a wide variety of topics. What are the chances of me being cured? How can I suspect that I have an infection? What about rejection? Will I need to take medication for life? And so forth. And then workshops and webinars. TransplantChild organizes every year a workshop, which is a full-day workshop. You can see here the last two workshops in 2021 and 2022. I won't go into details, but I want to introduce the next workshop, which is about to come in a couple of weeks' time. It will be held in June the 13th at La Paz Hospital in Madrid. But you will be able to follow it online, and that's what this webinar also wants to go. It wants to spread the information about this workshop and to ask you to share the news and to participate. The title is Psychological and Chronic Challenges in Pediatric Transplantation. You can find the program, the full program in the link in the website. And here, I just want briefly to explain what is the aim of the workshop, and is to address the interplay of psychological and social factors when it comes to pediatric transplantations, because we are well aware that the challenges, the difficulties that the patients and the families encounter are not just the one associated with the transplant procedure itself. That's just a part of the challenge. But then there is also the range of emotional, social, psychological, and everyday life practical difficulties. So I think that this workshop really addresses what I said at the beginning is the goal of TransplantChild, cutting across the different type of transplants programs, because the workshop is looking at the well-being of transplanted patients beyond the medical condition itself, and having then a holistic approach. So you will see from the agenda that the speakers come from all over Europe, Poland, Sweden, Spain, and England, just to name those ones in the first slide. And the speech really cover a variety of topics, like the mental health of transplanted children and adolescents, the impact on siblings, and the impact of the transplantation in the family as a whole. Or again, later in the morning, we will be talking about the transition, which we all know is a crucial phase in every type of chronic disease, not only with the transplant, but in our case, of course, when it comes to transplant, because we all know that kids will grow up. They will stop being kids. They will become adolescents. They will become young adults, and the system itself and the support needs to be adjusted. And then the afternoon will be dedicated to more, let's say, medical topics, and there will be speakers and speech addressing the different types of transplants. Then TransplantChild organizes webinars once a month. Here are some examples, just to show you the big variety of topics covered. But the reality is that so far our webinars have been prepared, held by specialists and nurses on medical topics, and they were addressed specifically to specialists and nurses as training and education resources for them, which is good, which is what we need. But we want to introduce a new type of webinar as well, more specifically thought and developed for patients and families with the help of patients' associations as well, including educators, psychologists, any other type of professionals involved in the pediatric transplantation. So we really want, this webinar now that we are holding, we want to tell you, we would like to have webinars in the future proposed by you, and maybe even held by you. And then the channels, we have different channels, as I said, targeted channels to disseminate our work. First of all, the newsletter. It's published every 3 months, and then we have 2 extra newsletters after the board of the network, which is twice a year. And the network is the perfect channel to disseminate all the activities carried out by the network till then, and to advertise the upcoming ones. So we really invite everybody to subscribe to the newsletter. This is the link. Oh, okay, I hear my voice. No, okay, not more. And this is what happens when you click on the link. So you fill in the form and you submit your request for the newsletter. Here you can find also the past ones. We really encourage you to do that because it's the best way to be always updated on what we do. And then we are on the different social media. This is thanks to Jorge. He's the one behind the scene of the social media. So we are on Twitter, we are on Instagram, on Facebook, on LinkedIn, and then you saw, of course, on YouTube. Here are some examples. You see, this is Facebook, this is Instagram, LinkedIn, and this is Twitter. As I try to cover, I go back a bit, different topics, different posts, from scientific congresses to local events. This one is one in Padova, to the Spanish National Transplant Day, or even covering, you see, our workshops, our webinars, or the monthly live case discussion, because we do discuss difficult cases once in a month within the network. So the idea is to first of all subscribe on YouTube channel, on TransplantChild YouTube channel. It's easy. You just go there and you click subscribe. But you should do it because as the likes and the shares of the post, those are for us and for the European Commission itself tangible ways to see that we are out there, that we are reaching our audience. Because otherwise, without seeing that there is an increase of subscriptions and increase of likes and shares, we cannot know exactly if we are reaching the people we want to speak with. And then we encourage you to share your post about local and national events, about even your stories or your group of peers. Share your post with TransplantChild. Or even more, we would really like to have a post every week. And we would like to have the next post made by you, made by the patients' associations, which introduce themselves with pictures, who give their contact details, because in this way we can promote what it is done locally at the European level. So this is the email we created, dissemination-transplant-child@googlegroup.com. Sorry, I couldn't read at the end. And this could be one channel to reach us, but then you can, of course, send a post on the social media and we will read you. Now I will leave the floor to Anna for the new resource developed.
Thank you very much, Federica, and thank you for presenting all these resources that we already have. knowing that it's our main aim in our ERN to have more and more patient-centered approach. We ask you, and we prepare this survey that is especially dedicated for patients and families, so we are able to know our patients' opinion about what is already done, what we have already available, so in the future we can better address patients' needs, patients' preferences, while we are preparing and developing new content, when we are planning new materials, when we decide which topic we should develop, and also when we decide and when we prepare, and we see how we should disseminate this kind of information. So we prepared, can you give me the next slide? Yes. So we prepared this survey that, as I told you, is especially dedicated to patients and families. It's a very short survey. It has, I think it's 8 questions, which requiring short answers or even multiple choice answers, as I'm going to show you in a minute. It can be filled in both on your computer, as you can see on your left side, and or on your phone, as you can see the picture on your right, sorry. And we wanted to have in our patients' native language. So it's clear, it's easier for them to fill it in, and you can see that it's easy to select the language. We already have it in English, in Spanish, in Italian, and in Portuguese, and we hope to have all other languages in a few weeks. Can I? Yes. So the questions are really simple, clear, because we want to know with who we are talking about. And so the first question is we only ask the one who is filling in the survey to identify himself. So if it's a transplanted child, adolescent, young recipient, if it's a parent, other relative, or other, like patient association, for example. And then we invite people, if they never visit our website, they should do that, so they will be able to answer our next questions. That is regarding what we already have and what Federica also presented now, the TransplantChild information pills, the tips, testimonies ebook, infographic on pets, and the book of recommendation for transplanted children. And we want to know their opinion on length. Can you move? So if they think it's too short, adequate length, a bit long, or too long, how the interest that they found in this material, not interested at all, if I was interested in some of them, if I found them quite interesting or very interesting, and if they learn anything from these materials, many things, some things, I remember things that I have already forgotten, or I already knew everything that was told. And finally, about understanding. It was very difficult to understand. Some things I didn't understand. I understand almost everything, and it was easy to understand. So we can rate and score our materials. We can see if we need to improve some of them. We can see how we can develop new materials, and where else it's important for our patients and families. Next. Also, we want to know more about your opinion on the tips. So we ask you to score again 3 topics that you appreciated more. Continue, please. And then while planning for the future, we ask you some ideas on which topic would you like us to develop, or would you like to learn more about. We give you some ideas like nutrition after transplant, healthcare on foreign countries and or vacation, transition to adult care, and risk of native disease recurrence. But this is these are only some ideas, because after each question we always give you some place for an open answer, because there are many other topics or concerns that you might have, that patients might have, and so they are able to tell us about that. Next, then we ask which format would you like us to use. So if you prefer short videos, postcard, posters, brochures, webinars, or even in-person seminars, or any other format. So again, so we can prepare new contents and the way that they will reach patients in the best way. Next, and again, how would you like this information to reach you? So, for example, if you prefer social media, LinkedIn, Facebook, X, Instagram, TikTok, or a message, WhatsApp, email, or even videos, web, YouTube, or wherever, or any other channel that you think is more appropriate. And at the end, if you have any other suggestion or recommendation that you'd like to share with us. So it will be really, really good to have as much as more answers as possible to this service, so we can prepare the next few years, the next contents and the new materials that we want to develop as more appropriate to our patients and families. And again, and as Federica already said, it's really important for us that we reach our patients. So it would be great if we could already hear and from this webinar to have some volunteers to translate this survey and some of the materials that will be available very, very soon. As I told you, we already have it in English, Italian, Portuguese, and Spanish. We need all other languages, so it's clear and more clear and easier for our patients to fill in the survey. As Federica already told you, it's not translation from zero, from scratch. George will provide you with already a pre-translated material. So you only have to make few corrections, few notes, so it will be easier for your patient to fill in. Otherwise, of course, we will communicate and email operational areas, so they can also email and contact TransplantChild centers, because we really need these translations during the next 2 weeks. It's very important for us that, and for everyone, that this survey can be launched during our next board meeting in June 14, and then we give 2.5 months to our patients to fill in the survey. During vacation, it will be easier for them, and then in September we will be able to analyze the results and to prepare new materials and to develop new contents for the future.